You want to avoid distractions. You want to make sure you have an order for suctioning, because you should. Though a lot of places will do have protocols that cover you, so if your patient is like drowning in their secretions, you're not going to wait to go call the doctor. Most places have some kind of protocol, but to know that there is usually an order. You want to check for any allergies, just to make sure that all the equipment and stuff you're using, they're not allergic to it. You want to make sure that you get your suctioning, your kits. Your kits do have gloves in them, but if you have bigger hands than a medium, which I do, you have to bring your own. Or if you have really small hands, because when the gloves are real big on you, it's hard to manipulate the catheter also. So if you have really tiny hands or bigger hands, you probably have to grab your own gloves. So beware, just know that. So or else they're in the kit. You want to put a towel on your patient. Can you check that drawer over there, see if there's some checks?
I need to get him and I left him there too.
Here, I'll go. Okay. So yeah, you want to put this on your patient because they can get messy. They have a lot of secretions. You don't want to get it all over them. If they have a lot of secretions and you think that they're going to cough all over you, then you want to protect yourself too. So if they're coughing, they have copious secretions, you may want to put on a gown. Lots of times I would put on a gown when I did because I didn't want to pick Ubers off of my just scrubs, which they will, especially with trachs. Not so much with nasal oral, but trachs, they start coughing, and guess where it goes?
That's the only time I ever got
Yes, yes. So when we do trachs, especially, you really want it. Lots of times you want to just put on a gown because you're gonna be suctioning, and when you suction them, they're gonna want to cough. It's a natural. It's a natural reflex. Yes. Yeah. When you go to suction them, they're gonna start coughing. So, so you just know that if they start coughing, you're in their line of fire. So, so just beware of that. So you might want to put on something to protect yourself. Stethoscope, because you're going to assess your patient. You want to see how they sound before and after. You want to make sure you have the canister set up, because sometimes these are not automatically set up in the room. You want to make sure it's all been set up for you and that you have it going. Sometimes they might have them in the room, but they might not be connected. There might not be any tubing on it. So you want to make sure before you get started and you get sterile, you have everything you need in here. A Yankar. Do we have a Yankar? There's one over behind me. Oh, here it is. Okay. And this is your Yankar. What is this?
Oral suctioning.
Oral suctioning. So this is usually a suction in their mouth. You should never put this into a trach or anywhere else. There was a student said, "Oh yeah, we've seen them use that in people's trachs." No, never. That just horrified me. No, this just goes in their mouth. It's not sterile because is your mouth sterile?
No.
No. And some places actually have nice ones now. I've seen where there's actually like a cover that draws back and then it comes back forward. So it keeps it a little cleaner. If not in the package, you can put it in the bedside drawer. You know, if it falls to the floor, then of course you want to put it in their mouth. But otherwise, it's not sterile. It's just clean and it's just used to suction their mouth. And that's just to get secretions in their mouth out. And it gets connected to this and you turn on your suctioning. You can just suction out their mouth. That's your anchor. So you want to make sure that you wash your hands. You want to make sure that you have their call light in reach or identify yourself, privacy, all that stuff. Tell them what's going to occur. So you want to tell them, I'm going to be suctioning your nose and your mouth. It could be uncomfortable because it's not going to be the best feeling in the world. Put them to a comfortable height. And make sure you adjust the lighting so you can see, because you want to be able to see what's going on. You want to confirm that they need suctioning, so you want to put the pulse ox on. You'll probably be standing a little bit low, so that will be one indication. Somebody had a lot of fun with rubber bands. I'm not really sure why. That doesn't make any sense, but so so we're going to listen to your patient. Then you also want to check their pulse ox. Usually you'll see that start to come, that'll be lower. So you want to check their pulse ox, and it does, goes usually this way. But you're going to start to see that drop because they're not getting good oxygenation. So you're going to see that start to come up. No, it won't usually go down that low. But you might see it go lower than so they've been 95, 96. Now all of a sudden they're in the low 90s, the high 80s, because they're not oxygenating well. So you're gonna see that drop, and you also want to put it on there because you don't want them to go too low. Like if you're suctioning too low, you're gonna see that start to drop, but that's not good. That means you're blocking their airway and they're not getting oxygen in. Especially when you're doing trach, because when you put a suction catheter into a trach, what are you doing? You're including it. Yeah. So and you'll see them like, because there's nothing going on. So that look means that they are not breathing. So just at least with the nose, you have the other note in there to breathe out of, unless it's like clogged up. They have a little bit more, but when you go into that trach, they're not breathing for that period of time because you've got that in there. So just be aware of that. You want to make sure you turn on, so you're listening to your patient. You're going to hear them course, you know, so that is an indication that they need to be suctioned. You're going to hear the upper airways lots of times are blocked up, so you're going to hear that. So you've assessed them. You want to have them sitting up. You want them in like a semi-fowler, so you want them pretty high. You want to put the pad on them, and you're going to turn on your suction depending on your patient. You want to put it on continuous suctioning because you're going to do intermittent with your finger. Because you don't want intermittent suction, because intermittent suction, like when we learn NG, what it does, it sucks, and it gives a break, and then it sucks. So you don't want that when you're suctioning, because you don't want to go in and then figure out it's not sucking right then. So you're going to do that with your finger. By moving your finger on and off the suction catheter, that's going to control it. You want the wall to be on continuous, because you'll see when you at the clinical site, it says continuous off, it says on, off, and intermittent, basically, is what you'll see. So you want to put it on. You don't want to put on intermittent suction. That's for different things. That's for like an NG tube, because it sucks and it stops. Bring your table close to you, and then you're going to open your packages. You also want to put your oxygen on your patient.
Right there, on the wall. It's on the wall.
No, but I mean
There's tubing.
the tubing.
Yeah, it's right there.
Oh, is that it?
Oh.
So you want to make sure you have them. If they're on oxygen, you want to turn it up a liter or two from where they're at. If they're not on it, then you might want to give them a little bit of oxygen or have them take a few deep breaths before you do this. And probably if you're going to put on their oxygen, you have some gloves on.
Would the tubing be sterile, or would it come in a bag, or does it just hang on the wall?
It usually is hanging on there. If it's a brand new one, it'll be in a bag, but it's not necessarily sterile. It's just clean.
Oh, okay.
Yeah, it comes in a little plastic bag. Sometimes if they don't have it, you can have them take a few deep breaths, see how bad they're statting. If they're lower, then you might want to put a little oxygen. If they're still statting over 90, you probably don't need to put any oxygen on them. So you make the call.
Do you want us to clean the cannula first then, before?
Clean it?
Yeah, like with.
It's clean. They've been wearing it. The patient's going to have oxygen. So what I want you to do is turn it up a liter or two from where it's at. So you're hyperoxygenating. So let's say they're on a liter, I'm going to turn it up to 2 liters. So I'm hyperoxygenating my patient. So my patient's being hyperoxygenated. Okay, so like I said, so now I'm going to open up my kit. Oh, I want to assess their nose. I want to look if there's any polyps or anything that I could cause damage to. Ask them if they've had any nose surgery, anything that, if they have an increased intracranial pressure, you want to be careful to suction them. So anything that would adversely impact the ability of you to suction them. So you want to make sure you're aware of that. So I'm going to open up my sterile package. I'm going to get my stuff out of the way because you want it less crowded as possible. Because you're likely to contaminate if you've got stuff sitting all over. I'm going to open this. And can I touch the outside of this package?
The outside? Yeah.
Like this? Or the inch within the borders?
Yeah.
Yeah, I can. And even if this comes off slightly, the sterile stuff is still inside. So even if that like touched the table, it's not a big deal at this point. Now if your catheter touches the table, then it's a big deal. But like right here, if it slides a little bit off the package, it's not a big deal because the sterile stuff is still inside. Make sense? Mm-hmm. So now what I'm going to do is I'm going to pull out the box. And I want to see which is the top and which is the bottom. And then open it up and have that there. Here. And then and sometimes you can, and again, you can adjust stuff if you need to and put it where you need it. Just don't touch the sterile gloves in there. So you can put stuff, you probably want your box closer to your patient because you're going to have to reach the suction catheter so you're not doing this kind of thing. You want to keep your eye on your patient because it's your sterile field. So you want to keep your eye on your patient. So I've got everything set up. I want to get this close to me because I'm going to contaminate my one hand. So I want this close. Again, I don't want to be reaching all over with one hand sterile I want to have it close by, so I've got this close by me right here. And let me make sure I don't forget to say anything. So now I've got that. You're going to take your saline. If it's been pre-used, you want to lip it and then pour some in here for yourself. And then you get this out of your way.
Is it lip it?
Which means you just pour a little bit out.
So it's, okay.
So it's clean as it can be, yeah. So you pour a little bit out. If it's been pre-used, if it's new, you don't, you just pour. If it's been pre-used, you kind of pour a little bit out into the garbage, and then you pour it in. Just making sure it's cleaner. And then, so now I've got saline in there. Don't put saline in the mannequins, because they will be all sorts of gross stuff. We were doing NG tubes, and we put an NG tube, and all this stuff came out of the NG tube. And the students were like, wow, you guys make it look real. And then we figured out it was moldy water because we started smelling it. So yes, these are mannequins. So whatever you put in there will stay in there, and it will get moldy and gross. So for case here, let's just pretend with the water. Let's not put it into the mannequin. Because there's only really one hole, so it doesn't really go into the lungs. If you start putting stuff in there, it all goes into a little mannequin belly, and then it starts to grow old. So, yeah.
Yum.
Yes, it smelled pretty gross in that little physical assessment room. It was like all of a sudden it was like, what is that? And I'm like, oh, we had to get out and clean up the whole thing because it was just disgusting. So yes, beware of that. So I want to open this thing up now too before I open my gloves, because then with my sterile gloves, I guess you could touch it with your sterile gloves too. So either way, or you could pre-have it open and ready for you. So it's up to you how you want to do it. Just be careful with it. If you're using the gloves in here, then your gloves will be upside here. If you're using another pair, then you want to be careful when you're opening this, not to contaminate your sterile field. And those are medium, so if you are medium, then that's fine. And I have it upside down. Make sure not to go over the package at all. Grab my first glove, and Donna, let me know if I do anything. If I screw up in any way. Or you guys, you could call me on it. Don't do this. I did? No. I don't do it often enough, and you really start to lose practice when you don't do this every day, you know? So when I used to do it, I was really good at it. Now I don't do it that often, except when I show you guys how to do it. So you start to lose practice. That's why it's important to keep practicing your skills. So the first one you put on, you just want to make sure you hold it from the cuff, and this one really is hard to contaminate unless you try really hard. This is where you can contaminate, because you're putting a sterile hand and you're trying to get the other glove on. This is usually where the errors happen. So what you want to do is you want to grab this just by here. You want to protect your fingers, and what are you going to do with this thumb? Thumbs up, because people want to put it here. Now I'm putting my hand in, what am I doing? You're contaminating your thumb. So that's probably the most common thing I see people do. And watch where you put this. If you're doing this, what am I doing? Contaminating. And you get nervous and you don't realize it. So kind of bring it up. Bring it up. You want to have things above the waist. So you've got your fingers in there, bring it up. So you're not tempted to drag this across this paper over here. Bring it up here, and there's really nothing you can contaminate. If you have it like this, it's not going to touch your sleeve. It's not long enough to do that. So then you put this thumb out. You very carefully put that on, and then let it be. Let it go. When I see people trying to fix this, that's usually where they go wrong. It's covering your hands, it's protecting you enough. Just leave it alone. Because that's what I see people trying to fix this up, and then all of a sudden they're touching their wrist, and now you've contaminated yourself. Is that what you did during your return? Yeah. You're looking at it.
When I was practicing, I had a hard time. I got it for my catheter,
but you couldn't let them go. Yeah, just let it go. Even if two fingers are in one, then just let it go. Because now I've got it on, you can fix that. You know, like don't try to do, once you've got them on all the way, now you can fix that. You can kind of do this, fix your fingers nicely, because now you're sterile and sterile. But just be aware of that when especially when you have the one glove on, you can't reach with this hand to fix your hand. So when you get nervous, and those, I know you understand it, but when you get nervous, those things start to happen. So just be aware of that. So I'm going to tell my patient to take a few deep breaths. I'm sterile now. Sometimes keeping your hands together like this helps, because then it doesn't tempt you to touch your nose or other things while you're doing it. So you see that in the OR lots of times when they're not doing anything, they tend to do this because that keeps them from, because naturally if our nose gets itchy, we're going to want to reach for it, but when you have our hands closed, it makes it less likely that you're going to reach for stuff. You'd have to, then that's a bigger movement than just, so keep your hands, you just think in for a minute, just keep your hands together, because they're both sterile, they're fine to be together. So now what I want to do is I'm going to contaminate one hand, but first I want to pick up this catheter. So the little catheter's in the bag here. So I'll pick up my catheter, and again I want to keep control of this catheter. I don't want it waving all over the place. And then what I do is wrap it around my hand. That way I keep better control of it. So again, it's not wiping all over the place. And then now I'm gonna contaminate this hand. So this hand's gonna be contaminated because I'm gonna connect it to this. So I'm gonna connect this to this. You wanna be very careful not to contaminate at this point. And then you're gonna hold that like that. So now this is connected. You're gonna lubricate it just with the saline. At the same time, you're listening for it to work. So it should be like shh, shh, shh. It's sucking up the fluid. That means it's working. Your suction is on, everything's okay. So now I'm ready to go. Now what I wanna do is I wanna take off the oxygen just for the patient for a minute. So I like to hold it up again high. Hold it high and hold it away from you because, you know, especially women with the breast, if you're holding it here, they're gonna contaminate your catheter. So just hold it kind of away, wait for you and far, where you can't get into trouble with it. And down here it's not sterile, so this is not a big deal. You want to keep this part of it. So if you hold it up, that part of it's not going to get contaminated. You want to just kind of pull that off. And I know it works. Am I going to suction going in? No. You want to keep your finger out because you don't want to cause any damage. And you can actually suck oxygen out of them as you're sucking in. So you're actually going to make them more, desat more. So you don't want to suction while you're going in. You want to actually do it once you're where you're going to be. And so you want to take your catheter. I'm going to keep my finger off. So this is not suctioning. This is suctioning. This is not. Now it's not doing anything. So I'm going to go in gently. And then you're going to kind of meet resistance. And then you want to suction back. And you want to go like that. So you want to come back. And then you kind of want to give them a break. Let them take a few deep breaths. Clear it because there'll be a bunch of gooky, yellow, gross colored stuff in here. So you want to clear that out so it's nice and clean. And you're cleaning the end if there's anything on it. Then again, you want to just give them a little time to recover. You're going to let them know what you're doing. Have them take a few deep breaths. And then you want to go back in. Put it in there. You want to keep your finger off while you're putting it in there. And then you're going to and you put their oxygen back on. Give them a little break. Have them recover.
Is your right hand technically sterile now, or is it okay because it's only got germs related to the patient suctioning?
Yes. So it's still technically sterile. You want to keep it sterile and it's only got the patient's germ. The patient's germs are already there, so we're not worried about that. We're worried about putting C. diff, MRSA, other germs into his airway. It's technically, they're probably sick, so they do have some germs, but really your airway should be kind of pretty sterile. So if you're going down someone's airway, it should be sterile. The only germs that are going to be there is whatever germs are making them sick. Well, they already have those. We don't want to add to those germs and put newer germs, better, more resistant, better germs in there. That's what we don't want to do. Now, if they're still kind of stuffy, you can do it again. You know, you can do it a third time. You really don't want to keep going because then you can damage their mucosa and stuff. So you don't want to over suction. You can go in one more time if you have to, if they still sound congested. And then the last thing you can do, which this grosses everybody out, is you want to clean this, and then you could clean their mouth. And yes, your mouth is dirtier than your nose because your mouth has a lot of bacteria. Your airway is actually sterile unless you're sick. There's really not much germs in there. So, so your mouth you can suction. You can go on the side. It's gross. Is that what you said? Yes. Yeah, the gross is a yeah, it's the same tube. Yes.
You are rinsing it in the saline.
And you're rinsing it in the saline, yes. But you won't want to do this if they are confused. If they're confused and they can bite down on that, then you don't want to do that. Then you want to use your yank card. Because if you're using your this, if they bite down on this, they could actually take the end of the catheter and choke on it. So you don't want to. If they're really confused and you think they're going to bite down, then I wouldn't even do that stuff. I would just get rid of my catheter and then get your yank card and suction out their mouth if you're seeing stuff in there. And you will lots of times. When you do this, you'll see all the stuff pocketed in their mouth if they're impaired and they're not getting rid of that stuff. You'll see it all in the back of their mouth. So you can use this. If you think if they're kind of comatose and they're not moving around much and it's okay, then you can go ahead and do their mouth. But if you're afraid or they're not if they're cognitive that they're not going to bite down, but if you're afraid they're going to bite down, I wouldn't use this. It's a thin plastic. You can easily bite down and put that, and then now they're choking on the end of your catheter, which is not a good thing. So you're going to get rid of this.
So for the demonstration, we're getting rid of it?
Yep, getting rid of it. You could just throw it in garbage.
Okay.
Don't even try to save it. Just throw it. What?
When we do our return demo, so, I mean, you were just pretending, are we actually going to be able to use the suction and hear it going, or are we just,
yeah, unless we get one of the sim hospital rooms. In the sim hospital rooms, there's real suction. That's the only place that has that really.
Yeah, we did in sim, but.
Yeah, it depends like what room we get assigned to. So. If we actually have us in the hospital room, then yeah.
Okay, otherwise we just verbalize, okay, we're listening to make sure it's.
It's suctioning,
Suction.
yeah, you can make the sound shh. Students like to do that, makes them feel better. Yeah, but, yeah, so the only places that has real working suction, because these were all pre-built before we got here, but we built the SIM centers, so the 2 SIM centers are the only places that have real working suction, so they actually have it on an air compressor that really suctions. So. But yeah, the other ones don't really suction.
So do you want us to actually suction the mouth also?
Yes, as part of the return, you're gonna do it, but just be aware of in real life, if they're like combative and confused, you don't want to put the catheter in, because then you'll be wrestling them for it, and they can bite the end off, so that's not good. So, so your patient is okay, you know, now you can take off your sterile gloves if you want, or if they're not really dirty, you can leave them on while you finish assessing them. So, anything else? So yeah, he's okay. Now we can put the oxygen back to where it was. We can listen to their lung sounds. The pulse ox should be much better because now we suction them. It should be back to where it was previous to not being well. It's 90 plus, it's 95, 96. He's doing much better. So I've turned down the oxygen back to 1 liter, which was at. I've turned off my suction because I'm not going to need this anymore. So I can actually turn this off, hang this up here because I don't need it at this moment. I am going to get the patient comfortable. I mean, in the return, it actually says to roll this up, but I mean, if I'm still dealing with the stuff, I usually leave my sterile gloves on unless they're like really contaminated. If you have all sorts of stuff on your gloves, you want to take them off. But for the return, they say you can actually just take these off, roll it up in there, and then you can clean your hands. But if it's not really dirty, you can use them. They're still a pair of gloves. You can still use them to clean up the room. Just make sure you want to take those off and then clean your hands after you take those off. And you reassess your patient, they're doing better. You want to ask them if the bed is comfortable. If it's too high for them, you can bring them down a little. But I want to bring them flat because they're obviously having respiratory problems, so you don't really want to lay this kind of patient all the way flat. They can breathe better if they're sitting up a little bit. So you want to look at their saturation, what are they breathing at. You want to make sure you throw away all your stuff and that you document that. So you're going to document, what did I suction? What did it look like? What color was it? How was the patient before, and what do they look like after I suctioned them? So was their pulse ox and respiratory status before? What do they sound like? Now I suctioned them, and now that I've suctioned them, this is what their respiratory status is at now. So that's all going to be documented, and what the secretions look like. Any other questions? No?